Good afternoon, I'm Stacy Sobin, one of the NIAMP faculty members, and we are in Denver, Colorado teaching C511, Lumbar Spine 1. We've done the lumbar component, and we're now on to a brief review of SI assessment and treatment. We're about to demonstrate a gapping manip of the SI joint, and we're going to have you join us for that. So, in order to perform this gapping manip of the SI joint, we went through and we did our standing weight-bearing assessment to determine, are they actually symmetrical in their movements? So, I'm looking for symmetry. I'm not saying the SI joint moves 10 degrees, 5 degrees. I'm looking for that balance from side to side. Do they have that normal symmetry? I look at them in standing, and then I lay them down and look at them in a non-weight-bearing position. If they present with the same dysfunction in standing and in non-weight-bearing, then they're appropriate for this technique. If there is a discrepancy between the weight-bearing component of the test and the non-weight-bearing component of the test, then I'm going to use something different. I'm not going to use a manipulation. I may use some soft tissue, exercise, needling, whatever you need to help with that neuromuscular balance component. But we're going to demonstrate that gapping manip of the SI. I'm going to do it on this side, but to demonstrate where I place my towel, I'll show you there. So I take a rolled up washcloth or pillowcase, and I'm going to roll them over here. And I want to, if the sacrum has spinous processes, I want to stick it kind of along for the transverse process of the sacrum and up the lumbar spine transverse process, up L4 and L5. That's to help protect the lumbar spine. And then I roll them back. Since you can't see this side, that's why I demonstrated there. We're going to do the technique here. So let me get this under here for you. There we go. So basically, I now have the towel, the washcloth there, underneath the sacrum. I am going to come in, you can put that leg down, I'm going to come in and the pillowcase is going to hold the sacrum stable, and I am going to gap the innominate away from the sacrum. I bring them up into a flexion, slightly adducted, internally rotated position, and I do my pre-manipulative hold. I hold them here, I push down through the femur, hold it for 10 seconds, and I say, does this reproduce your pain? No, I'm going to give you a thrust. You might hear a pop or a click. You okay with that? So pre-manipulative hold is negative, and I have his verbal permission. Get him into the position, and what the manipulation looks like is I'm pushing down through the femur, I'm taking up the slack, and I take it all the way up to the end, and then it's a quick thrust. It is a high velocity, low amplitude thrust at the end range of motion to gap the innominate away from the sacrum to gap that SI joint. Thank you for joining us. If you have any questions, we'll take it in the comment section below, or you can check us out at niamp.com.